dear students. Now let's discuss a very important exam related topic, that is anatomy of retropharyngeal space. And as this is not a separate topic, basically the questions which come in the exams, that is about retropharyngeal space abscess or retropharyngeal space infections. So first of all, going before to the abscess part or the disease part, we have to understand the relevant anatomy of the respective space. Okay, so I have divided this lecture into two parts. That is, first part is the description of anatomy of retropharyngeal space, and in the second part we will discuss about the disease itself. Okay, so let's understand about the anatomy of retropharyngeal space. Before going into the details of anatomy, I want to tell you that this is not about the cramming up of boundaries such as anteriorly this, posteriorly that, superiorly, inferiorly, blah blah blah. No, all these things are written in your book. Okay, so I will try to explain here in a very lucid way that how exactly the retropharyngeal space is formed. Okay, so don't put any kind of pressure on your brain right now. Just go through this slide. Only read this slide. Do not try to remember, do not try to memorize this. You will automatically answer the questions after one or two slides. Okay, so just we are going through this slide. What is retropharyngeal space? It is space situated between the two fascia, that is buccopharyngeal fascia and alar fascia. Again, I am trying to tell you, do not memorize anything from this slide. Okay, just wait. It extends from the skull base to the posterior mediastinum. So this is the extent. Anteriorly there is buccopharyngeal fascia, posteriorly alar fascia, superiorly skull base, and inferiorly fusion of buccopharyngeal fascia and alar fascia. Okay, so just we have read about the anatomy of retropharyngeal space. There is no need to remember from this slide. Okay, now coming to the next part. Focus on this slide, it is very important. It will tell you in detail about all the boundaries, anterior, posterior, superior, inferior, that we have discussed about till now. Okay, so superiorly, as you can see, I have written skull base, and inferiorly there is written T2 vertebrae, okay, and diaphragm. So now what happens is there is a fascia that runs from the skull base to the T2 vertebrae and skull base to the diaphragm. Okay, so just focus on few fascia that will make the understanding much easier. Okay, so there is a fascia that will be drawn in the white color pen that is going to extend from the skull base to T2 vertebrae. Okay, so this is the fascia. It is also known as alar fascia. Okay, it is alar fascia which divides the retropharyngeal space into two compartments that we'll see we will see further in this. Okay, so this is the alar fascia in white color, and anteriorly to the alar fascia, as we can see, there is another fascia in green color pen that is getting fused with the alar fascia at the level of approximately T2 vertebrae. Okay, that fascia is known as buccopharyngeal fascia. The fascia in white is alar fascia, and the fascia in green color that is drawn is buccopharyngeal fascia. Okay, so the space between these two fascia, buccopharyngeal fascia and alar fascia, is known as the true retropharyngeal space. This is known as true retropharyngeal space. Okay, now what is the role of diaphragm here? Another layer of fascia that comes from the skull base and goes up to the diaphragm, that is known as prevertebral fascia. Okay, so there is another space is being formed between the alar fascia and prevertebral fascia. That part is known as posterior compartment of the retropharyngeal space. Posterior compartment of the retropharyngeal space. Okay, now we can see alar fascia is dividing the retropharyngeal space into two parts. The anterior compartment space between the buccopharyngeal fascia and alar fascia is known as true retropharyngeal space, and the space between the alar fascia and prevertebral fascia is posterior compartment of retropharyngeal space. Okay, so it extends from skull base up to T2 vertebrae, and anteriorly there will be buccopharyngeal fascia, posteriorly there will be alar fascia. Okay, so that was all about the retropharyngeal space. As you can see, there are two compartments, anterior compartment and posterior compartment. Anterior compartment is also known as, this is the final picture of the retropharyngeal space anatomy. Here we can see all its extents. Now you don't have to remember or memorize anything. Superiorly there is skull base. Inferiorly you can say T2 vertebrae, or in some books as I have seen written, that is posterior mediastinum. So that is also correct, no issue with that. You can also say that retropharyngeal space extends from skull base up to the posterior mediastinum. That is also correct. Okay, so anteriorly there will be buccopharyngeal fascia, posteriorly there will be alar fascia. Space between these two will be known as true retropharyngeal space, and the space between the alar fascia and prevertebral fascia will be known as posterior compartment of the retropharyngeal space. Okay, so that was all about the anatomy of the retropharyngeal space. Now coming to its contents, what are the important contents of the retropharyngeal space? There is nothing much. Simply there will be fat and few lymph nodes that will be known as lymph nodes of Rouvier. So that was in brief about the anatomy of retropharyngeal space. It is very important from exam point of view, and in the next video we will discuss about its diseases, its abscess and infection. Okay, so stay tuned and follow us for more such contents. Thank you.